trachea, it expands and from the thyroid gland. Most of this thyroglossal duct disappears. Somewhere it may persist, I will show you later. And then what it produces, if it persists, if this thyroglossal duct persists, then what it will develop, I will discuss later. Now, look at this picture. Now, you see the pyramidal lobe. Pyramidal lobe. As you already know the parts of the thyroid gland, there are two main lobes, that is called lateral lobe. They are connected by intervening part. What is the name of that intervening part? No. Already discussed. This intervening part, main two lobe, lateral lobe, this intervening part, which is connecting the two lateral lobes, what is the name? Isthmus. Very good, thank you. Isthmus. This middle part is isthmus. Isthmus may come as a surface marking, important surface marking. Isthmus, where it lies, as which level it lies, from where trachea starts. Thyroid cartilage आपने देखा? Thyroid cartilage का नीचे, what is that? Cricoid cartilage. Then, after cricoid cartilage, what starts? First ring of thyroid cartilage. Now, in front of which thyroid tracheal ring? In front of which tracheal ring isthmus lies? 2, 3 and 4. 2, 3 and 4. You will remember it because there will surface marking will come from here. Now you see it is more or less quadrangular shape. It has this isthmus has upper border, lower border, posterior surface and anterior surface. From its upper border you see one elevation is found, that is called pyramidal lobe. That pyramidal lobe is attached, sometimes it may be attached to the hyoid bone by levator glanduli thyroidi. Right? Levator glanduli thyroidi. The extension of the thyroid gland. Here you see the lateral lobe. It has a pyramidal shape. It has an apex and base. Apex reaches where? Apex reaches where? Very good, oblique line of thyroid cartilage. And this apex is sandwiched between two important muscles. What is that muscle? Sternothyroid. One is sternothyroid superficially, and deep is inferior constrictor. Inferior constrictor. Inferior constrictor. That's why when the gland enlarges, it will enlarge to what direction? Either downwards and laterally and posteriorly also. Right? If it enlarges posteriorly, then which structures it will compress? Very good. It may compress esophagus, then it will produce what? If esophagus is compressed, then what is the name of that condition? When esophagus will be pressed, will you be able to swallow? No. Then what is the name of that condition? Dysphagia. Dysphagia. If trachea is compressed, then what will happen? Patient will not be able to breathe properly through trachea air entry. So patient will suffer from dyspnea. And there is important nerve between the trachea and esophagus. There is a groove between trachea and esophagus. One important nerve lies What is the name of the nerve? What is the name? Tracheoesophageal group. क्या नाम है? कब पढ़ेंगे? आप तो एग्जाम तो ज़्यादा दूर नहीं है. Recurrent laryngeal nerve, very good, thank you. ये पढ़ना पड़े. Recurrent laryngeal nerve. If recurrent laryngeal nerve is compressed, then it will produce one condition that is known as, I have already told you, the recurrent laryngeal nerve supplies all the muscles of larynx except cricothyroid. Cricothyroid you will see later on. So if that nerve is compressed, so larynx will not function. Then what will happen to your voice? It will down. What is the hoarseness of voice? So it will produce hoarseness of voice, dysphonia. It is called dysphonia. So dysphagia, dyspnea and dysphonia because of the pressure effect of the thyroid gland. Right? So this is about the enlargement of thyroid. What is non-inflammatory, non-neoplastic enlargement of thyroid gland is known as, non-neoplastic means tumor. Tumor नहीं है, tumor में तो बड़ा होता है. And non-inflammatory, goiter, very good. That enlargement is called goiter, right? So this is about the pressure effect of the thyroid gland. Now from this, I have already told you, it has two coverings, one true covering and false covering. True covering means which is developing from within the gland, that is from the fibrous tissue of the gland, that is called internal capsule. Internal capsule, and outside external capsule, but false capsule. That external capsule is derived from which layer of the deep fascia? Pretracheal layer. How many layers are there of deep cervical fascia?
3 layers.
What are they?
Pretracheal, investing and
prevertebral, from anterior to posterior. First investing, then pretracheal, then prevertebral. So it is the pretracheal layer which forms the false capsule. Now next question is, between the true capsule and false capsule, what lies? What important structure lies? Absolutely wrong. Between true and false capsule, venous plexus not lies. It lies in prostate gland. The main difference is venous plexus lies deep to true capsule. That means within the gland. That is the criteria of the thyroid gland. That's why when thyroid gland is removed by surgeon remove along with the internal capsule. But in case of, why are you laughing? दोनों को आउट कर देंगे बाहर. And so this important question may be asked. Now you have to trace the pretracheal layer. This pretracheal layer, after investing this gland, will be attached to, if you trace above, where it will be attached? जो अपनी आप swallow करते हैं, swallow.
Yes, sir.
Then what will happen to this gland?
Yes, sir.
It will remain where it is, or it will move also along with your swallowing. Huh?
Yes, sir.
It will move or not move?
It will move, sir.
Why it will move? After investing the gland, this pretracheal fascia is attached to, here you see the thyroid cartilage, there is an oblique line. It will be attached to the oblique line, and also it will be attached to the, above the thyroid cartilage there is a hyoid bone. It will also be attached to the hyoid bone. Below there is a cricoid cartilage. There also it will be attached, cricoid cartilage. So there are 3 attachments from hyoid cartilage, then thyroid cartilage and cricoid cartilage. 3 cartilage. It is attached to that cartilages. That's why when you will swallow, that cartilage also will move, and along with the thyroid gland also move. Now one attachment is very important, that is That is the attachment of the investing layer of deep cervical fascia with the cricoid cartilage. That attachment is known as ligament of Berry. Very important ligament. Because of that, you cannot move this gland. It is attached, firmly attached. And through this ligament of Berry, one important nerve is passing. That is recurrent laryngeal nerve. At the time of operation, thyroidectomy, surgeon must take care of this ligament, because through this ligament and through the branches of the inferior thyroid artery, recurrent laryngeal nerve is passing. That recurrent laryngeal nerve may pass in front of the loop of the inferior thyroid artery, or it may pass behind the loop of the inferior thyroid artery, or it may pass through the branches of the inferior thyroid artery. There are three conditions. Because of this, it is very important relation. So you should keep it in your mind. If ligament of Berry comes as a short note, you have to mention all these things. This picture, it is very important for relations of the thyroid gland. It is the transverse section at the level of the thyroid gland, right? Here you see. Now this gland, I have already told you, it has got how many surfaces are there in thyroid gland? 3 surfaces. What are the name of the 3 surfaces? Anterolateral surface, and then posterior or posterolateral, and medial surface. Now tell me medial surface. You tell me. Medial surface is related to, on seeing this diagram, medial surface. Medial surface is related to which structures?
Sir, trachea? No, trachea not. Inferior thyroid artery.
Trachea. First you have
No, sir.
right.
Inferior thyroid.
Trachea, and what is the structure behind trachea?
Behind trachea, sir, inferior thyroid artery.
पहले बोलो ट्रैकिया पीछे क्या है? Esophagus. So there are this medial surface has got 2 tubes, 2 nerves, and 2 muscles. This medial surface. This 2 tube means, you should say like this, not only trachea, you should say larynx and trachea, because it both laryngeal cartilage, so larynx and trachea, pharynx and esophagus. These 2 tubes and 2 nerves, recurrent laryngeal and superior laryngeal. Superior laryngeal divides into internal and external laryngeal. Now, which one will come to this relation? External laryngeal. Internal laryngeal कहाँ जा रहा है? Internal laryngeal कहाँ जा रहा है? It is not coming into relation because superior laryngeal nerve divides into external and internal laryngeal nerve. This internal laryngeal nerve pierces the thyroid membrane. Upper thyroid membrane. So it is not coming. And what are the 2 muscles that will come? Medially 2 muscles will come. Inferior constrictor and 2 जो muscles आता है, what are they? And cricothyroid. Inferior constrictor and cricothyroid. These 2 muscles will come in its medial relation. And in superficial relation means anterolateral surface. Superficial surface. Superficial surface पे ये जो देखो muscle बड़ा बड़ा देखे जा रहा है. What are they? Sternohyoid. उसका पीछे superior velum omohyoid. डीप में है स्टर्नोथायराइड. पहले स्टर्नोथायराइड, उसका ऊपर स्टर्नोहयोid एंड सुपरफिशियल ओमोहयोid, एंड सबसे बाहर है sternocleidomastoid. These three muscles, 3 to 4 muscles come to its superficial relation. Means superficial or anterolateral surface of the thyroid gland. Now posterior surface. Posterior surface, I have already told you, medial surface is known as tubal surface because tube comes in its relation, and muscular surface is anterolateral surface because muscles comes in relation, and posterior surface, or you may call it posterolateral also. That posterolateral surface, what structure comes in its relation? Carotid sheath, very good. Containing, carotid sheath containing, where the common carotid artery divides into internal and external. At which level? At the upper margin of the thyroid cartilage. तो अपर मार्जिन ऑफ थायराइड कार्टिलेज में अगर डिवीजन हो गया एक्सटर्नल इंटरनल, तो उसका तो नीचे थायराइड ग्लैंड है, তাহলে एक्सटर्नल कार्टिलेज आर्टरी আসবে
না,
তাহলে তুই বলি एक्सटर्नल कार्टिलेज आर्टरी তাহলে কি আসবে? कॉमन carotid will come. So this carotid sheath contains common carotid artery medially, internal jugular vein laterally, and in between and posterior lies one important nerve, that is vagus nerve. So it is the posterior relations. From this diagram, you will be able to arterial supply of the gland. Arterial supply of the gland. Now, superior thyroid artery. You see superior thyroid artery. That superior thyroid artery, this is superior thyroid artery. It is coming from which artery? Superior thyroid artery coming from which artery? Superior thyroid artery. Here you see superior thyroid artery has divided into two branches. One is going anteriorly and one is going posteriorly and downwards. Along the posterior margin, you are seeing the posterior aspect. Here you are seeing the posterior aspect of the gland. That means posterior border you are seeing. Along the posterior border you see two arteries are meeting. One is posterior branch of the superior thyroid artery and another is a branch of the ascending branch of the inferior thyroid artery. They are meeting along the posterior margin. Right? Now, you see the recurrent laryngeal nerve. This recurrent laryngeal nerve, you see, it is passing through the branches of the inferior thyroid artery. Right? Now, inferior thyroid artery, it is the branch of, inferior thyroid artery is the branch of, diagram देख के बताओ. Inferior thyroid artery is the branch of arch of aorta का कितना branch है? Brachiocephalic, from right to left, brachiocephalic. Then left common carotid, then left subclavian. Now this brachiocephalic trunk divides into right common carotid and right subclavian. From the right subclavian, this artery, inferior thyroid artery, comes out, arises, and it is supplying the, entering into the gland at its lower pole. So these are the two arteries, and there is another artery that is directly come from the arch of aorta, arteria thyroidea ima, that is coming directly from the arch of the aorta, and other arteries also supply. They are the arteries of the arteries supplying the trachea, artery supplying the esophagus. So from there also some contribution may come. They are called accessory arteries of the thyroid gland. They are coming from the arteries of the trachea, arteries of the esophagus. Because medial surface lies in contact with this tubal structure. So from there, some supply may come also to the thyroid gland, right? So these are the arterial supply. Now venous drainage. Short essay type of question may come. Supply, vascular supply of the thyroid gland. Because you know thyroid gland is important because it is very vascular gland. So that question, very important question may come as a short note or short essay type of question. The supply, vascular supply of the thyroid gland. So arterial supply ho gaya. Now venous drainage. What are the venous drainage? Superior thyroid vein, middle thyroid vein, and inferior thyroid vein. Superior thyroid vein will drain into the internal jugular vein. Here you see. Superior thyroid vein, it is draining into the internal jugular vein. Then next, middle thyroid vein. Middle thyroid vein also draining into the internal jugular vein. And this vein, that is inferior thyroid vein, it is coming from the isthmus. And it is draining into the, mostly it drains into the left brachiocephalic vein. Sometimes also it may also drain into the right also, but majority of cases it drains into the left brachiocephalic vein. And there is another vein that is called Coccus vein. It is not always present, sometimes it may be present. It is just below the middle thyroid vein. It also drains into the internal jugular vein. Right? So these are the venous supply. One important lymph node here you see. Just above the middle thyroid vein. What is the name of that lymph node? Delphian lymph node. This Delphian lymph node, why it is important? If you know the thyroid gland is very important gland for its malignancy. If cancer develops, so first gland where metastasis may occur, that is called Delphian vein, which lies in relation with middle thyroid vein. This Delphian vein. You have to know the lymphatic drainage. Lymphatic drainage. If you cannot remember, you should remember pre-laryngeal lymph node in front of the larynx. There is pre-tracheal lymph node in front of the trachea, and where this is the omohyoid, where omohyoid is crossing the internal jugular vein. There also lies some lymph node that is called jugulo-omohyoid. Right? So this jugulo-omohyoid gland may be involved. Pretracheal lymph node may involve. Pre-laryngeal lymph node may involve. Some lymph node lies along the recurrent laryngeal nerve. That also may be involved. যে সমস্ত গ্ল্যান্ডে বেশি ক্যান্সার হয় সেই সমস্ত গ্ল্যান্ডের লিম্ফ নোডগুলো সব পড়বে লিম্ফ্যাটিক ড্রেনেজ দ্যাটস ওয়াই লিম্ফ্যাটিক ড্রেনেজ অফ স্টমাক, lymphatic drainage of breast, lymphatic drainage of uterus, lymphatic drainage of thyroid, lymphatic drainage of tongue, because these organs are prone to develop carcinoma. So their lymph node is very important from your examination point of view. You have already known that thyroid develops from thyroglossal duct, and thyroglossal duct extends from the foramen cecum up to the where the definitive thyroid gland develops. Up to that, this circular area actually it is the area from where ectopic thyroid gland may develop. Ectopic thyroid gland where it may develop. So throughout the root of the thyroglossal duct, anywhere it may develop. Right? So if it is developed in relation with the tongue, that is called sublingual. And if it is related to the hyoid, so it may be subhyoid, suprahyoid, etc. Right? Now, if this thyroglossal duct persists, if thyroglossal duct somewhere persists and it may develop thyroglossal cyst. So if any swelling in front of the thyroid, I mean in front of the trachea, that swelling may be lymph node, it may be thyroglossal cyst. Now, how will you distinguish whether it is lymph node or thyroglossal cyst? By one single clinical test, you can distinguish whether it is lymph node or thyroglossal cyst. What is that? Thyroglossal. That means it is connected with the glossal means tongue. So if a cyst is attached to the tongue, then what will happen? If you protrude your tongue, then what will happen? It will also move with the protrusion of your tongue. If a swelling moves upwards with the protrusion of your tongue, then it will go in favor of thyroglossal cyst. And if it doesn't move, if it is lymph node, so it will not move. So when you will do your duty in OPD, surgery OPD, such type of cases may come. Then you have to diagnose. By this simple clinical test, you can diagnose whether it is thyroglossal cyst or simple enlarged lymph node. Right? Is your question answered? Any queries?